Welcome to our presentation on nutrition and osteoporosis based on the Osteoporosis Canada 2023 guidelines. For context, we'll start with talking about Jennifer's story, which is similar to that of a lot of patients that we see in clinic. Jennifer is a 75-year-old woman who was recently diagnosed with osteoporosis after a fall during her daily walk where she broke her arm and a recent bone mineral density test confirmed low bone density. She is wondering if she can help manage her condition with changes to her diet. If you have been diagnosed with osteoporosis or are looking for ways to manage your osteoporosis through your diet, then this presentation is for you. Here's an overview of the topics that we'll cover today in this presentation. We'll start with a brief introduction, discuss Canada's new food guide for bone health, then calcium and vitamin D, talk about some medications, as well as other nutrients, and end off with some conclusions. Optimizing nutrition is an important component in the management of osteoporosis. Osteoporosis Canada has developed specific nutrition recommendations for postmenopausal females and males aged 50 and older, which are integral to our approach in osteoporosis management. Today we'll explore evidence-based nutrition strategies that support bone health and enhance outcomes for people living with osteoporosis. The Canadian Food Guide provides essential guidelines for achieving a balanced diet rich in key nutrients vital for bone health, including calcium and vitamin D. It's important to note that if you are consuming a well-rounded diet and not on medications for osteoporosis, supplementation with calcium, vitamin D, and other nutrients may have only a limited impact on fracture prevention. Overall, a foods-first approach is recommended to optimize nutrition for overall well-being. Moving on to discussing specific nutrients, calcium is essential for maintaining bone health and supporting the bone remodeling process, which is crucial for bone strength and density. However, as we age, our bodies become less efficient at absorbing calcium. Men aged 50 to 70 should aim for 1,000 milligrams of calcium daily through a combination of diet and supplementation, while men aged over 70 should increase their intake to 1,200 milligrams daily. Women, on the other hand, over 50, should target 1,200 milligrams of calcium daily. It's important to note, though, that exceeding the upper limit of 2,000 milligrams daily can have adverse effects. If you have chronic kidney disease, please discuss supplementation with your doctor. There are diverse sources of calcium that can support bone health. Osteoporosis Canada provides a helpful calcium calculator tool to assess your daily calcium intake. As you can see from the picture here, calcium is not solely obtained from dairy. Fortified plant beverages, salmon with crushed bones, calcium-fortified tofu, and fortified orange juice each provide approximately 300 milligrams of calcium per serving. If you are not able to get enough calcium from your diet, a supplement can be considered to make up the difference. Vitamin D is another essential nutrient for bone health. It is both consumed in our diet and a vitamin that our body produces upon exposure to sunlight. In Canada, however, sun exposure is not adequate for most people to meet vitamin D requirements. For adults aged 51 to 70, the recommended dietary allowance for vitamin D is 600 international units per day, while those over 70 should aim for 800 international units per day. The upper limit for vitamin D intake is 4,000 international units, as beyond this amount should be monitored as there can be harms. For individuals requiring additional vitamin D, supplements are recommended, especially for postmenopausal women and adults over 50 years old, with a minimum daily dose of 400 international units of vitamin D3 or D2. Through your diet, vitamin D can be obtained from eggs, which provide approximately 80 international units per egg, and salmon with over 500 international units per serving. Specifically in Canada, we can get vitamin D from fortified milks and margarines, which typically contain around 200 international units per serving. For people on treatment for osteoporosis, adequate supplementation with vitamin D is needed. It's important to discuss with your healthcare provider regarding vitamin D and calcium intake, as your targets may need to be individualized. vitamin D levels can be assessed through a 25-hydroxy vitamin D blood test with a target of 50 nanomoles per liter considered adequate for bone and overall health in healthy individuals. We will now briefly touch on protein, vitamin K, and magnesium that may be involved in bone health. Protein should be included at every meal to promote bone and muscle strength. Protein supplements have not been shown to reduce hip fractures, but dietary protein remains important. Research has shown that dietary protein levels, approximately 0.8 grams per kilogram of body weight per day, is recommended, and it is usually derived from eggs, lean meats, dairy products, beans, and nuts. Magnesium, abundant in our diets, also contributes to bone health and can be found in fruits, vegetables, protein foods, and whole grains. The evidence for magnesium supplementation in fracture prevention remains uncertain. Similarly, vitamin K, found in abundance in our diets, plays a role in bone metabolism and can be found in fruits, dark green vegetables, and protein foods. Likewise, the evidence for vitamin K supplementation in reducing hip or total fractures is of low certainty, emphasizing the importance of obtaining vitamin K from dietary sources. Nutrition is a key element of the management strategy for osteoporosis and should be individualized with some of these general principles. A foods-first approach is recommended, and it is recommended that postmenopausal women and males over 50 eat foods that are rich in calcium and protein, as well as consider supplementation with vitamin D of a minimum of 400 international units daily. For additional information and resources on osteoporosis nutrition, we recommend visiting the Osteoporosis Canada Nutrition section, available at the link here. To assess your daily calcium intake and support your bone health, you can use the Osteoporosis Canada Calcium Calculator, accessible with the link here. The Calcium Calculator tool helps determine your calcium requirements and offers recommendations based on your age, gender, and dietary habits.